Facial nerve, it is a seventh cranial nerve. Generally, it is a mixed type of nerve that is motor, sensory, and autonomic function as well as the nucleus of facial nerve that is both. अम्मा जरा आवाज कम करो ना. Superior salivatory, lacrimotory, and tractus solitarius. So these are the nucleus of facial nerve: brachiomotor, superior salivatory, lacrimotory, and the tractus solitarius. The pathway of generally for the facial nerve, that is intracranial segment, intratemporal segment, and extratemporal segment. There is no any branches from intracranial segment. Okay, first we see intracranial segment. So there is no any branches for intracranial segment. Second is intratemporal segment. So the branches of facial nerve with facial canal, and it is a part of intratemporal segment. That means the intratemporal segment gives the branches, so that are greater petrosal nerve, nerve to stapedius, chorda tympani. Okay, so total three: greater petrosal, nerve to stapedius, and chorda tympani. First is greater petrosal nerve. It supplies the lacrimal gland and soft palate muscles. Okay, then nerve to stapedius, it supplies the stapedius bone, and chorda tympani, it supplies the salivary gland and carrying taste sensation from posterior two-third of tongue. Remember, it carries sensation from posterior two-third of tongue, because generally people is like facial nerve only supply muscles of facial expression, but not, it also supply posterior two-third of tongue, lacrimal gland, soft palate, and salivary gland. Then branches of facial nerve exist from stylomastoid foramina, and it is also a part of extratemporal segment. Okay, so in that, the posterior auricular nerve, nerve to stylohyoid, nerve to posterior belly of digastric. Okay, so total there is three: posterior auricular nerve, nerve to stylohyoid, and nerve to posterior belly of digastric. We see one by one. First is posterior auricular nerve. It supply occipitalis and orbicularis oblique muscle. It supply occipitalis and orbicularis orbicularis oblique muscle. Second is nerve to stylohyoid. It supply stylohyoid. The function of stylohyoid muscle, that is, it drew a hyoid bone backward during swallowing movement. So it is a function of stylohyoid. It drew a hyoid bone backward during swallowing. The nerve to posterior belly of digastric muscle. So digastric muscle શું કરશે? It elevate the hyoid bone during swallowing. The third branch, that is branches of facial nerve, that is terminal branches. Okay, so terminal branches, it is also part of extratemporal segment. So the first is temporal branch, second is zygomatic branch, third is buccal branch, fourth is mandibular branch, and fifth is cervical branch. Total 5 terminal branches. So first one is temporal branch. It supply of frontalis and orbicularis oculi muscle. So that two muscles are responsible for the facial expression muscles. Okay, second is zygomatic branch. It supply a zygomatic major and minor muscle. So which is the action of the zygomatic major and minor? It deviate the mouth. Third branch, buccal branch. Okay, name suggests action. It supplies a buccinator muscle. Buccal, that means supply buccinator muscle, responsible for pouting movement. Fourth is mandibular branch, that it supplies the depressor labii muscle and depressor anguli and mentalis muscle. Fifth is cervical branch. It supplies the platysma muscle. So these are the terminal branches. Clinical part of seventh cranial nerve, that is facial palsy and Bell's palsy. Two. Okay, first one is facial and second is Bell's palsy. First, facial palsy, it is also known as UMN lesion. Okay, UMN palsy, or we can say it is a supranuclear lesion also. Causes for that: stroke, intracranial tumor, syphilis infection, HIV infection, or MS, that is multiple sclerosis. So these are the general causes for facial palsy. Symptoms: contralateral facial muscle weakness. Okay, generally in facial palsy there is no any ipsilateral weakness or paralysis is seen, but the lesion is present on contralateral side. So contralateral facial muscle weakness is present. Lower quadrant of facial muscle paralyzed at the opposite side. Bell's phenomena absent. Remember, Bell's phenomenon absent is facial palsy and present in Bell's palsy. Okay, so what is Bell's phenomenon? So it is upward movement of eyeball on attempt to closing of eye. Then taste is not affected in facial palsy. Taste sensation is normal. No hyperacusis. Hyperacusis means abnormal or unwanted sound in ear. That is hyperacusis. And corneal reflex also intact. That means normal. So these are the symptoms of facial nerve palsy. Now we see about Bell's palsy. Okay, Bell's palsy, it is also known as element lesion, element type of lesion, or element palsy. Okay, so causes are idiopathic, generally unknown cause. There is no any major causes for Bell's palsy. Some minor causes that are cold exposure, high blood pressure patient, tumors, trauma such as facial injury, and chronic middle ear infection. These are minor causes for Bell's palsy. Then clinical features of Bell's palsy, that is facial asymmetry, loss of facial expression in affected side, ipsilateral facial muscle weakness. That means in facial palsy lesion present opposite side, but in Bell's palsy the ipsilateral facial muscles are affected. Corneal reflex is lost. Bell's phenomenon is present in Bell's palsy. Then nasolabial fold become flattened. Loss of wrinkles of forehead, drooping of angle of mouth on affected side, and unable to close eye on affected side. This is the major sign, unable to close eye on affected side. But in facial palsy the corneal reflex is intact. There is no any inability to closing eyes in facial palsy, but in Bell's palsy patient is unable to closing the eyes. Epiphora, that means overflow of tears on cheek. Drinking, whistling and speaking impaired. That means problem in drinking, whistling and speaking. Hyperacusis present. That means abnormal continuous sound which is felt into the patient ear. Okay, that is known as hyperacusis. Recovery within 3 months, mostly in Bell's palsy. The scale which is generally used for Bell's palsy measurement, that is House and Breckman grade scale, and second is Sunnybrook scale. These two scale are useful for Bell's palsy. Thank you.